morning. My name is Sandra. How are you doing today? I'm a UFIS student nurse, and I'll be one of your nurses today. And before I get started, let me get my hands clean here. And can I get your name and date of birth? And assuming the patient had a bracelet on, checking the patient's bracelet. Okay, verifying they are who they are. Okay, and just to let you know what we're going to be doing today, we're going to be starting an IV in your arm. We need to give you some fluids. So we're going to be giving you some regular fluid, some sodium chloride, just so you can get a little bit more hydrated so that you can feel a little bit better, okay? All right. And before I get started, let me just verify, are you allergic to any latex or adhesives, any tape, anything like that? No? Okay, well, let me double check your allergy band. Okay, I don't see any allergies. So, all right, well, let me gather my supplies here and we'll get started. Also, let me just go ahead and give you some privacy. We're just working on your arm, but I do want to pull this curtain. Okay. Give you some privacy in case someone comes in. And this is, have you ever had an IV before? Okay. So, you know, I'm going to try my best to get it on the first time and, you know, just work with me here. And it looks like you have some good veins. So we'll get you taken care of. Let me get some more hand hygiene here. I did gather all of my supplies. I have your sodium chloride, regular sodium chloride, isotonic solution. I've got my IV needle. I've got my IV start kit and my J-loop. I've got a normal saline flush, and I've got my IV tubing. And so first I'm going to set up your pump with your fluids so that when we get ready to go, it'll be all ready for us, okay? Just hang out with me here. Let me get your bag set up. You doing all right today? Good. Glad to hear that. Well, like I said, once we get this started, you should start feeling better. It's going to put some fluids back in your body. I know you've been missing some of those fluids, so it'll be real good. I'm going to try to find a good spot where you can bend your elbow normally and bend your hand normally, okay? So I'm going to get this bag prepared and take this cap off. And now I'm going to stab my bag. I'm going to stab that in there and squeeze it to make sure I'm in far enough, but only fill it about halfway. And once I've got that taken care of, I'm going to unclamp this and into the trash can without dropping it into the trash can. I'm just going to take the lid off and unclamp this and be able to prime my line until most of the bubbles are gone. Okay, I'm going to drop that into the trash can. And I'm just going to hang this line back up here until we're ready for that. I'm always just being careful to not touch the tip of that. That's going to go into his arm, and being careful that my IV tubing does not touch the ground. All right, I'm going to also again perform some more hand hygiene before I don my gloves here and get ready to give you your IV, sir, okay? So we're going to do this. We're going to do it quick and painless, okay? So again, just going to don some gloves. Not necessarily sterile gloves, just clean gloves, but it is an aseptic technique. So we want to keep everything as sterile as possible without necessarily having sterile field. So I'm going to open my IV kit now that my IV line is ready. Oh, you know what? Before I do that, I need to set up this pump. Go ahead and set this up. A little premature on hanging that. Get this part off of there. And this clampy part in there. Clamp that in there for catch the air bubbles. And pull that up through there. All right, now let's dial this in a little bit. Making sure my line's not clamped here, and again, making sure I don't touch the end or let this touch the ground. But I am clamped here, so I'm just gonna let this beep at me. I'm gonna turn it on. And I can hang this back up here while I wait, as long as it doesn't touch the ground. Okay, new patient. No, Mr. Smith did have this IV yesterday, so he's not a new patient. So I'll confirm that Mr. Smith is on the med-surg floor. Select channel A, guardrails IV fluids. It is 9% normal saline, 0.09%, sorry, normal saline. Is this correct? 0.9% normal saline? Yes, it is. Okay, so for our rate, we're going to run 100 milliliters per hour, and my volume of my bag is 250 milliliters. And I want to go ahead and start that. It's going to check the line. I do have it clamped here, so it's going to beep at me. But while we start your IV, Mr. Smith, it's just going to beep for a minute, so just please bear with me. We'll get this started pretty quick, okay? I feel like I can press pause, and then it won't beep at me while I do the IV. Yeah, so it's pause. Now I should be able to just start that when we're ready. At this point, since I did go back and touch this before changing gloves, I'm going to go ahead and go change my gloves again. Sorry, I only brought one pair of gloves over. Didn't anticipate to need 2 pairs. I should be more prepared than that. But I performed some hand hygiene and now don my gloves again. Alright, let's find a good vein on you here, Mr. Smith. Alright. Well, you've got some good ones. I'd really like to go in this one right here by your hand. Because, of course, if I'm going to start an IV, I'd want to try to start somewhere down lower and just move more proximally, just in case I blew the vein. It does look like he's been stuck quite a bit right around here, and maybe even some infection, so I wouldn't want to stick through that. I'm going to unclamp this so I can get a return. I'm just feeling for veins. I feel like that's probably one that's been used too much, and it looks like it's been blown a little bit more up here, so probably skip that one. Looks like he's got a good one here on the ulnar side. So we're going to go with that. I got my IV start kit just to verify on his veins. I'm going to go ahead and, there's my gauze. I'm probably going to go ahead and put a tourniquet on just to verify my site where I'm going to be. I thought it would stop for me. It just stopped just for a second. I want to get my 2 pieces of tape ready here. And I'm going to prepare a 3rd piece of tape just in case. I only have so many hands once the IV started. Take off the backing off of my tegaderm here. And open my J-loop. Connect that to my flush. Take the cap off there. And I'll be flushing that using my 10 milliliter normal saline syringe. Okay. I'll take my tourniquet. Sorry, that's going to beep at us here, Mr. Smith. I'm going to lift your arm up just a little. I think I see a good vein, but I'm going to go ahead and tie this tourniquet on here for us. Alright, and tie that just above Let me try to tie this a little better. Make sure we get that vein good and tight. All right. Yeah, so I found a good spot right there. Get that tourniquet off. Just gonna leave that there because we're gonna clean this, and then I'm gonna place the tourniquet back just to make sure we got the right spot. Let that air dry. I'm gonna pop this. The ChloroPrep, and take the ChloroPrep, and I'm going to clean this site where I'm ready to use. I don't know if I'm supposed to actually clean that or not. I did. Let that air dry. And then, like I said, pat the tourniquet down again just to verify. Yeah, that's going to be a good vein. I'm going to let that air dry. And I'm going to prep my needle here. Okay. All right. Good vein. Okay. I'll let that go. I'm going to uncap my needle, and then with the bevel up, I'm going to hold with my non-dominant hand. I'm going to hold this vein steady, and I'm just going to slightly insert my needle till I get some blood return. And hold this vein steady till I get blood return. All right. Good. And hold that vein steady. My non-dominant hand. I feel like Mr. Smith's been stuck several times. I just want to make sure that's open. Okay. And I am not getting any blood return. Not sure if that is working because I'm sticking Mr. Smith here in this vein that we found. Again, bevel up. Okay, I'm gonna pretend that I got blood return because I'm here in this vein that Mr. Smith clearly has. I'm going to advance the catheter into the skin and release the needle with this button. And I'm going to hold that down. I'm going to occlude this with my third and fourth fingers so as not to occlude the blood flow a little bit. And just to steady it, I'm going to take one piece of tape and secure that. I'm going to take my J-loop. I'm going to attach it to the end. I'm going to flush. Flush as normally. And there's some blood return. Okay. I want to be able to see that site. So I'm going to take my Tegaderm. Throw my sharps into the sharp container. Take my Tegaderm and I'm going to cover this. I'm going to pull the sides off here. I did have a 22 gauge needle. I think I failed to mention that. And then I was using a 22 gauge needle. I'll pull this all the way off, and then I'll pull this other tape here. I'm going to press that tegaderm as closely to the skin as possible. I'll put this here so I can initial that in just a moment. Okay. Alright, so while I got that attached, it's now time to attach my fluids. I'm going to disconnect my flush here. Disconnect it right there. Connect that. Take the blue part off, connect that. I'm going to take this with my another piece of tape. I'll tape down here at Mr. Smith's hand. And I'll tape up here so that lays on his arm. Now that my fluids are attached, I will unpause this and make sure to unclamp this. Okay, restart. And now it's going to be flowing. Normal saline, it'll occlude in a moment because Mr. Smith is a mannequin. But it's okay. So now we've got all of that. Okay, so Mr. Smith, this IV looks like it should be comfortable. I'm going to go ahead and initial. We've got a 22 gauge needle. I did this on 9/28, and I'm going to put my initials on here, okay? Go ahead and show that. I'll show the IV site. Show where it's taped. And the blood that we got returned over there. Of course, the 100 flow rate, it's occluded now because Mr. Smith's a mannequin. But channel A. Alright, so Mr. Smith, what I'm going to do is I'm going to go ahead and I'm going to put your bed down to the lowest position. Make sure your side rails are up. I'm going to throw my stuff away here. Is there anything you need or that I can get for you? I did make sure to throw my needle into the sharps container. Alright, well Mr. Smith, I got you set up with that IV. Those normal fluids will be running. If you do have any questions or there's anything you need, just let me know, okay? And I would like to give you this call light here. I'm going to perform some more hand hygiene. Okay, well, got that set up. So, all right, I think that's it.